Hello, I'm Dr.Kaustubh Kulkarni, infertility specialist, and I will be discussing with you the case of intrauterine insemination or IUI that is mentioned for fertility treatment. So first of all, this IUI is a procedure where if a couple comes to us and says we are not conceiving and they have been married for a short period of time, then invariably what we do is we subject this couple at the earliest to a procedure called IUI. Now just to put it in perspective, this is a picture, if you can see it. In this picture, what we are showing is a cut section of the uterus, और इसको हम गर्भथैली कह सकते हैं या बच्चेदानी कह सकते हैं. This is the inside lining of this गर्भथैली. This is the vagina which it connects to. Now, these are the fallopian tubes, one on either side. One of them has been opened up for you to see how it is. These are the ovaries, one on either side. Now this is all inside a woman's body, so this can't be seen from outside. So what is this process of IUI? In a normal woman, the ovary produces an egg which you can see here. Now this egg gets released and has to be picked up by the fallopian tube. Now, if this fallopian tube does not pick up the egg, IUI won't succeed. When this egg gets picked up by the fallopian tube, normally when relations are maintained, the sperm or seminal plasma is deposited here after intercourse. Now, this seminal plasma consists of water, or let's say a liquid, along with the sperms which are in millions, so they are plenty. So, IUI is a process where if the sperms are any less or if you have not conceived easily, this seminal plasma which had millions of sperms is separated from the seminal liquid, and all the sperms that are so aggregated are put inside the uterus by means of a small plastic tube. Which means, suppose a woman was not conceiving after 2 years of having relations, the plastic material which is used here as a tube will enter into the uterus, will deposit the sperms here. So the question you will ask is, why is it important? It is important because in the normal course, if the seminal plasma is deposited here, and say if there were 100 sperms, only 10 of those would enter here, which means only 10% can cross this barrier. Suppose this barrier was to be crossed, or the sperms were not capable, or they were weak, or for various reasons could not surmount it, then these sperms separately are brought out. They are separated and put inside the uterus by means of an inert plastic tube. So they are deposited here. That is why the procedure is intrauterine insemination. There is a further small area which the sperm has to still cross, because remember, as I told you, the egg will come out from here and it will be inside the uterus, inside the fallopian tube, waiting for the sperms to arrive. So these sperms will now cross one more barrier and finally reach here. What is important is for us to realize that by doing an intrauterine insemination, you are shortening the distance for this sperm which was normally supposed to be here, which would have to reach here. Instead, we are making the sperm start from here and reach up to here. Now, the frequently asked questions that are asked to us are, will all IUIs succeed? The answer is no. Because in IUI, remember, we are just extending or improving our chances of getting a pregnancy. If a couple who had no problem were to go only for intercourse and was going to attempt a pregnancy, nature has created a human being in such a way that out of 10 couples who attempted intercourse, even if we knew the day of ovulation, it is because the egg survives for only 24 to 48 hours, and if they had relations, only 10% will conceive in the first attempt. This is what is called as the human fecundity, and this is the highest. That means in 9 couples out of the 10, there may be nothing wrong. So they have to try one more time, and maybe they'll conceive the second time, or the third time or the fourth time. Now what IUI does is actually, because we are putting the sperms here, the possibility is that the distance for the sperm to travel having been shortened, and a large number of sperms that would have been wasted from here, those sperms are bought and put here. So the chances of this couple conceiving are double that, or at least 1.5 times of normal intercourse. The commonly asked questions that we are asked, one is IUI going to work if the tubes are blocked? The answer is no. Will IUI work if the tubes are partially open? Well, it depends. If the tubes are okay, it may work. How many times can we do an IUI? Well, usually it is recommended that 2 to 3 attempts should be made, but an investigation should be done to find out in the first or the second attempt if it has not worked. This can be in the form of a laparoscopy. This can be in the form of maybe further investigations in the form of a hysteroscopy. Now suppose you do an IUI and say the IUI fails, which happens in 8 girls out of 10 as opposed to 2 where it succeeds in the first attempt. Now the remaining 8 girls out of 10 can actually undergo one more attempt of IUI, and maybe another 2 girls out of the group of 10 that is formed can still conceive. The next question that is asked is how much rest you may need. To be honest, after an IUI procedure, which is done around the time of ovulation, you can have at the most 10 to 15 minutes of bed rest and you can go back to work. Sometimes we are asked, will an IUI work if the tubes have been damaged but now have been restored to health? Sometimes it works. This is a procedure which is a simple daycare procedure. An IUI does not require the patient to get hospitalized, usually is painless, and if it is done correctly, can give close to 15 to 18% pregnancy per cycle. It is recommended that a minimum of 2 to 3 IUIs be done first up, or they can be done more often as long as you expect a result, which means up to a maximum of 6 times. Usually we would recommend a laparoscopy or an investigation if it has failed for the first 3 times. But the chances are there that with a third or a fourth or a fifth IUI, a patient may still conceive. The other question is, will IUI only be restricted to males whose count is low? Sometimes it will work in patients of mild endometriosis. Sometimes it will work in patients whose husband's counts were a little defective, or even in patients where proper relations may not have been maintained. Is sonography necessary? The answer is yes. It is called follicular study. Is medication given in the latter half of the cycle? The answer is yes. Usually we recommend medication in the latter part of the cycle, which means the last 15 days. And in some cases, a blood test is done to find out whether the pregnancy has occurred. So what is the role of a patient? Well, if she is following up with the doctor regularly, he or she will give correct instructions as to when to meet next. Blood tests are usually done to confirm that the pregnancy may have started. It is difficult to interpret the result of an IUI, but usually a doctor, a fertility expert will come in and talk to the patient. Even if periods come, don't get disheartened. You may succeed in the next one. Usually, unless you have had short evidence that the tubes are working, IUI won't succeed. Sometimes if a woman is over 35 years, has ovarian endometriosis, has adhesions inside the tummy, or if the husband's count is very low where IUI won't be successful, a doctor may recommend to the couple to go straight away for IVF or test tube baby, or ICSI, which is intracytoplasmic sperm injection. I hope With this knowledge, you conceive, and we'll be looking forward to seeing you happy with the baby that you so desire. Thank you.